A better informed patient is a more compliant patient. So adherence to treatment, we have to start prior to giving these drugs because many of the patients are bothered about side effects. And that's a group of patients that is very likely to stop treatment. So we have to inform the patients before giving the drug that there might be problems. Patients are bothered about the previous treatments. A lot of these patients have had chemotherapy and they have already experienced side effects on chemotherapy and they are bothered about developing more symptoms on these oral aromatase inhibitors. So we have to reassure the patient. It has to be said that if the patient has so many side effects that we can always build in a treatment holiday. We can change one aromatase inhibitor to another. It may give less problems. Or finally, if the patient doesn't cope with oral aromatase inhibitors, we can consider the patient on tamoxifen, which is still a good treatment. You know, the feedback to these patients is so important. They shouldn't feel like they are being lost to their own problems. I can tell you that 1 in 4 patients, they feel like they are 100 years old if they start these drugs. 1 in 4. So these patients need to be well informed and managed, and you know, you have to take every single problem seriously and to discuss this with the patient. You have to be provocative, you have to ask these questions because the patients, they don't ask it.